So COVID is coming back, and we are having a beginning of a wave. And exactly how that wave will play out, I'll tell you what I think in a minute. So why is it coming back? Well, the main reason are probably twofold. One is that it's respiratory virus season, and so these viruses take advantage of lower humidity, colder weather. People are indoors more, they're together more, but the virus also survives a bit longer in the air and on surfaces when it's colder and less humidity. The other thing is the holiday season is a time to be jolly, and when you're jolly, you're with other people being jolly together, and that gives the virus a chance to transmit within families and friends and holiday parties and workplaces and so on and so forth. So those are the main two reasons. So even if we would have completely sheltered in place for the holidays, I still think we would be having an increase of cases. But the fact that holidays are a get-together time amplifies that. What's going on with variants? Well, the last time we talked, our main variants here in the triad were BQ1 and BQ1.1, which are sort of grandson and granddaughter of BA5, which is what caused our wave last summer, and great-granddaughter and great-grandson of the original Omicron in January. And in our area here in the triad, that is still true. But what a lot of us are watching right now is a new variant called XBB 1.5. So XBB 1.5. This one's a little bit more distant from BA4 and 5, and actually is a recombinant virus. I'm not trying to bore you with too much science, but what is a recombinant virus is when two viruses, messenger and RNA, get together, pop a bottle of wine and light some candles, and then exchange their information, and you get messenger RNA that's half of one virus and half of the other, and it creates a whole new virus, and that's what XBB 1.5 is, and that means it's different enough that it has more immune evasiveness. So for people who've had COVID before, or who've been vaccinated before, or for those who've had both vaccine and COVID before, it's going to be more likely to cause a breakthrough, quote, breakthrough infection. The other thing is that this one has a mutation that makes it attach a little bit better to the receptors in the back of our nose and throat, which is where the virus first attaches it when we inhale it from other people or from particles. And that makes it a bit more infectious. So of all of the variants that we've seen since the beginning of COVID, this one seems to be the most infectious of them all. What does that all mean? Well, this variant, the XBB 1.5 recombinant virus, has been the predominant virus in the mid-Atlantic in New England now for at least 3 weeks. In fact, it started to surface just right after Thanksgiving, but it's really kind of exploded in those areas. And now it's 80% of the viruses that we sequence out of New York and New Jersey. So that is their variant. Down here in the triad, it's only about 10% of what we're seeing. But I think just like what happened in New York and New Jersey over the next 3 weeks, XBB 1.5 will be the story here in the triad also, and will be our predominant variant.